Well, good afternoon, everybody. Thank you so much for coming today to hear all about multiple sclerosis and health and wellness. Hopefully by the end of this talk, I will have answered some questions for you that you might have had in regards to, well, I'm on an MS medicine or I'm not on an MS medicine, but what should I be eating? How much should I be exercising? Well, what about my job? What about going out in the community? How are all these things going to be pieced together to help my overall quality of life so I can improve how I do in the home, within myself, and out in the community? So hopefully by the end of this talk, I'll have answered some of your questions. I'm going to keep this pretty informal. So if a question comes up that you're just dying to ask and you're afraid that you won't remember by the end of the talk, please feel free to pop up your hand and say, "Excuse me, Dr. Hirsch, I have a question for you." Absolutely, not a problem, okay? All right, so moving on ahead. First of all, we're going to be discussing health and wellness, but before we discuss that, we should probably define what it is first, right? This is going to be kind of like sitting in school for a little bit, but I'm going to be a lot more interactive and engaging than like your typical teachers, okay? All right, so what is health? So health is a dynamic, ever-changing condition that enables an individual to function optimally, okay? So that is currently how your body is working, how it's functioning, how it's able to function, okay? That's something that is an inherent organic process, okay? The important thing is the wellness piece, because this is where you all come in to make positive choices about how you can improve your health over time, okay? So wellness is a lifelong, personalized process through which folks such as yourself make informed choices about lifestyle behaviors and activities across multiple dimensions to lead better lives. So this is where you all are coming in to help make your health better. You're going to make choices about, well, what am I going to eat today? Or am I going to exercise today? Or am I going to finally quit smoking? These are decisions that you're going to be making from a day-to-day basis to help improve your health. Okay? You all with me so far? All right, fantastic. So before we go on and start describing what are these aspects of wellness that I need to be aware of, let me just first talk about MS just a little bit, okay? I'm not going to make it boring, but why don't we just make sure we understand the process of MS before we get into the logistics of the wellness piece, okay? So multiple sclerosis is an autoimmune disease. Well, what the heck does that mean? If I hear autoimmune one more time, I'm going to strangle somebody, right? Autoimmune means that your immune system is working a little bit too well, right? Our immune system is there to fight infections, to fight things that are foreign to your body. You get a blister, you get a virus, you get a bacterial infection. But in an autoimmune disease, you have these activated T cells. Those are your white blood cells that are there to help fight infections, things that are foreign to you. But instead of just doing that piece, they're actually attacking your own nerves and neurons in the brain and the spinal cord that is actually causing this demyelination process. Demyelination means that you have this sheath, okay, kind of like a wire, right? This insulation piece that covers a wire that communicates from one neuron to another neuron. And these activated white blood cells start killing this myelinated fiber off. So the communication piece between one neuron and another neuron, it starts getting fuzzy, okay? It starts short-circuiting. The information doesn't get passed on from one neuron to another neuron as well as it did before it was attacked by these white blood cells. And depending upon where this damage is in the brain or the spinal cord dictates what kinds of symptoms you're going to have, what kinds of disabilities you're going to have, okay? Does that make sense so far in terms of the basics of how MS works? Okay. We don't need to go into any more specifics other than that. That's for another day, okay? Let's get to the more interesting pieces, okay? So how do we treat MS? Well, I look at treating MS in a few different ways, okay? So looking at the clinical aspect, okay, looking at the different medicines, there are 3 different ways that we treat that aspect, okay? One is treating the exacerbation or relapse or attack or flare. It all means the same thing. They're all synonyms, okay? When you get the new symptoms, the new exacerbation, we can either treat with steroids or we can treat with other medications if the steroids don't work, or we just carefully monitor. There's that piece. When someone has a new episode, we treat with certain kinds of medications, right? Okay. Then there are the other medications that we prescribe in order to prevent issues from happening going on forward. Those are new relapses, new lesions on the brain and the spinal cord, and to prevent the worsening of disability over time. And those are your medications like Avonex, Betaseron, Rebif, Gilenya, Tecfidera, Tisabri, Aubagio. I could go on and on. There are a lot of different medicines that we have out there. But those are our preventative medicines, right? The steroids for the exacerbation are kind of like the medicines that we use right away to treat a new episode. And these medicines are used to prevent new episodes, okay? That makes sense, right? Okay. And then the third piece of using medicines is the symptom management piece, right? You know, some folks have issues with burning and tingling. Other folks have issues with the spasticity, the Charlie horses, the muscle cramps. Other people need a medicine to help them walk better. Those are our symptom medicines, okay? Those are kind of like our Band-Aid therapies to help improve the quality of life while we're trying to prevent future disease activity with those medicines. That all makes sense, right? But there are other pieces to that, right? It's not just medicine, right? I mean, yes, the medicines are very important, but we also need to make sure that we are identifying other pieces to that as well, and that's going to be the gist of this talk, the wellness piece. We have to make sure that you all are taking care of your bodies in addition to taking care of the MS as well, because they're both synonymous. Yes, ma'am?
Within 3 days, my hands were like this and I couldn't walk. They
Correct.
gave me steroids.
Correct.
Now I'm on, after taking 3 different kinds of things, now I'm on Gilenya. But how do you know when you're having a flare? How do you know it?
Okay, that's an excellent question. So I'm going to repeat it, especially for our folks who are at a different site. So the question, what was your name, ma'am?
Susie.
Susie. It's nice to meet you, Susie. The question was, how do you know if you are undergoing an exacerbation or a flare, right? Because from a day-to-day basis, you may have little fluctuations, right? Where, you know, your hand might get a little tingly for a few minutes, but then it kind of goes away. Or, you know, you get some muscle cramps and then it's kind of bothersome for an hour and then it goes away, right? You get these little fluctuations from day to day, and sometimes it's hard to figure out, well, is this something new? Is this just something because I just exercised and, you know, now my symptoms feel a little bit worse. So usually the way that I educate my patients is when we need to start being concerned that there might be an exacerbation or a flare is if it doesn't go away over a 24-hour period. So if you have symptoms that, let's say you wake up and your hand feels a little bit crampy, and if it continues to worsen or doesn't get better throughout the course of 24 hours or a full day, then that might be the beginnings of a clinical relapse, okay? And that might be when you want to get on the phone and call us up so we can discuss or have you come in for an evaluation. Sometimes it is not an exact science. Sometimes it's difficult even for the physicians to determine whether or not this is an actual relapse versus, well, your body is under a lot of stress right now. You have a urinary tract infection, you have bronchitis, and maybe that is what's making things feel worse. Does that help answer your question a little bit?
Sort of. How do you know? Like, I'm getting older. Everyone's getting older. Well, how do you know what is supposed to happen when you get older and what is happening with the MS?
Correct, and that's also another important piece, and that's what we're going to describe a little bit with the talk that we're going to be doing today, because all of these things fit in together. Okay, so sometimes, again, it's not an exact science, and it's hard to determine. But usually the point that I try to counsel my patients with is that if something starts to happen and it continually gets worsened over the course of the day, doesn't get any better, doesn't start fluctuating, that's when you may want to be concerned that, okay, maybe this is something other than the fact that I had a hard day today, or I had a hard exercise, or I'm feeling really tired at the moment. And that's when you want to get on the phone with your doctor, because at the end of the day, it's up to us clinicians to treat and to determine what exactly is going on. But it's usually that piece where you're not improving after about a day or so that you may want to start looking into talking to your provider. Okay? All right. So predictors of multiple sclerosis. So right now we don't know what causes MS, okay? But we are working hard to try to figure this piece out. What we do understand is that most likely there is a combination of genetic factors and environmental triggers that actually predict the onset of multiple sclerosis in an individual, okay? But it's not a perfect science either, because there are lots of folks who come in to see me who there's no family history, that they're the only person in their family who ever developed MS, right? That happens quite a bit. So we don't really understand what is actually increasing the predictive increased risk of MS to develop in a single person. But we do understand that there's some things that might trigger an onset of MS in someone who has a genetic predisposition to develop MS, okay? So there's the genes component. There's the gender component. So we understand that women, for some reason, are affected with MS more than men. It's about a 2 to 2.5 to 1 ratio. May that be somehow related to hormones? Well, possibly, right? Because hormones is a big predictor of what makes us different as men and women. But again, we don't exactly know what that role is, okay? But from epidemiological studies, we do understand that women are affected more than men. Viruses. So there may be a piece to particular viruses triggering the onset of MS in people who have a genetic predisposition. There are certain viruses out there that most of us have already been exposed to already, and then certain viruses maybe not so much. There are lists of viruses, and I'm not going to go into that. That kind of goes beyond the scope of our talk today, but there might be something out in the environment in terms of a viral component that might trigger MS in someone who already has the predisposition to develop it already. But what I'm going to focus on today is the importance of vitamin D, the importance of smoking cessation, or if you don't smoke already, not to pick up a cigarette for the first time, okay? And then other environmental things that we can do in our daily lives to try to improve not only your quality of life, but the function and to minimize the amount of disability that you may have as part of the multiple sclerosis, because all of these pieces fit together. Okay, so there's the concept of vitamin D. So I want to get a raise of hand. Who took their vitamin D this morning? Right? Okay. So how many of you, now I'm going to get another, I want to get another survey. How many of you have heard about vitamin D and MS? Right? We talk so much, every single visit, right? I know I see a couple of familiar faces in here, but every single time you come in and you see one of us here, we're mentioning vitamin D. Are you taking vitamin D? How much vitamin D are you taking? And it's like, well, why do you care so much about my vitamin D, right? Well, this is why. Vitamin D insufficiency may increase the susceptibility in people to develop multiple sclerosis. There have been multiple studies looking at vitamin D, okay? And there might be something to it. It's not just, well, okay, fine, vitamin D is completely random, but there's something to it. It's called the equator theory, right? So this actually supports this vitamin D insufficiency theory. So this is basically just a geographical schematic drawing of the world, okay? And as you can see here, this line is supposed to depict the equator, okay? And as you can see, as you get further away from the equator, the increased risk of multiple sclerosis develops, okay? And it's in either direction. You can see in Australia, in New Zealand, in North America, in Russia, and then parts of Europe as well. Those areas represent geographical regions that have an increased risk of folks developing multiple sclerosis compared to the rest of the general population who live closer to the equator. And we feel that one of the big differences between folks who live close to the equator versus folks who live further away is how much vitamin D exposure they are getting, right? So people who live in Florida, that's where I'm originally from, they get exposed to sun all the live long day, right? But folks who live in other parts of the world like New England and Cleveland and Michigan and Canada especially, they get a lot less sun exposure because they're continually under a cloud, right? So we know from a fact just by looking at epidemiological studies and looking at big registries that folks who live in these areas have an increased risk of developing MS compared to folks who live near the equator. And that is where the vitamin D hypothesis is coming from, because they're not getting it directly from the sun. Now, that's not to say we live in Las Vegas, right? Okay, doctor, well, it's sunny every day here, so I'm going to get an adequate amount of vitamin D absorption, right? So I don't need to take it. It's not enough, right? So we know that just barely having a vitamin D level that is sufficient, which I'm just going to give you a number, 30. 30 is the lower limit of normal, okay? That's not enough. Not only have we shown that vitamin D insufficiency or vitamin D deficiency increases the risk of developing MS and increases the risk of poor prognosis in folks who already have MS, but we know that patients who are on vitamin D supplementation and have higher levels in their blood actually do better over time. We actually have studies that support that as well. So we've actually become more and more greedy over time with how much vitamin D we are comfortable with. So at first we were like, well, we just want you folks to be within normal limits, which means higher than 30, okay? But now we're getting more greedy. So the current guidelines suggest that levels above 50 carry the most beneficial effects. And now late breaking, we're becoming even more greedy. We're seeing that levels of 65 and above are actually the most beneficial. So you'll hear this on and on when we see you guys in clinic, that we want to make sure that we're checking your vitamin D levels on at least an annual basis to make sure that we are reaching these higher levels of vitamin D supplementation. And this is why we make such a big deal about it. Okay? Any questions on the vitamin D story so far?
That you consider good to take every day?
Sure. So, Susie, was it? The question was, how much is a good amount to be taking on a day-to-day basis? Okay, that's an excellent question. The answer is going to be annoying. The answer is it depends. So it depends on your absorption of vitamin D. Some people who carry a little bit more weight might need more vitamin D because vitamin D can get absorbed into the fat pads and it's not readily available in the bloodstream. So in folks who might be a little bit heavier, they might require more vitamin D to maintain where we want you all to be. So this is why we check vitamin D levels on a pretty routine basis. Typically, for my folks, I'm asking them to be on 4,000 or 5,000 international units per day. Okay, but that will vary depending upon if that is sustaining the vitamin D level to a good enough point. Okay, some people are on higher levels. Sometimes if the vitamin D level is very low, we will actually put in a prescription for an even higher dose of vitamin D for a few months to try to increase your levels even further at a faster rate.
Do you ever get people that have too much vitamin D?
I have not yet had anyone who've had too much vitamin D. There are some folks out there who are shooting for levels of 100, but I think that if we are at least getting to 50 to 65, we are going in the right direction. but I've yet to see anyone with vitamin D levels that were too high. Yeah, that would be quite the feat. All right, so I'm going to move on so I don't run out of time. Okay, so smoking. All right, and another thing that, my doctor talks to me about smoking one more time. But there is a reason for that, okay? So it's not to be mean mommy, because we've all had moms in the past, or we still have a mom or a spouse to kind of take the ruler and hit us over the hand. But it's to educate and to make sure that you understand why we make such a big deal about certain practices, okay? So we know that smoking or exposure to cigarette smoking, so even with secondhand cigarette smoke exposure, someone smokes in the house, can increase the risk of onset of MS, or can increase the risk of developing disability early, okay? So another study actually looked at a group of children who ended up having pediatric or children onset of multiple sclerosis. So they developed MS when they were quite young. And it showed that parental smoking at home was found to increase the risk of a first episode of MS before the age of 16 years old, okay? So there is reason why we make such a big deal about the smoking, because we understand that it actually is detrimental to the MS disease process. Not to mention that it increases cardiovascular risk, it increases stroke risk, and those things together, cardiovascular risk, stroke risk, can also increase the risk of disability with MS. So everything feeds together, okay? So the clear message is don't smoke. It's really a non-negotiable at this point, right? And there are programs out there for folks who do smoke to try to quit smoking, okay? So really clear message is just not to do it, okay? So there are all kinds of dimensions of wellness, okay? So remember how I had that original slide up that showed the 3 pieces to MS treatment, right? You have the relapses, you have the prevention medicines, and then you have the Band-Aid medicines, right? This is the 4th piece, and it's very important, okay? So this is basically the guideline to the different dimensions or domains of wellness, okay? So there are different pieces to it, okay? So you have the physical wellness, and we're going to touch base on all of these things, okay? You have physical wellness, you have emotional wellness, occupational wellness, spiritual wellness, social wellness, and intellectual wellness, okay? So when we initially think of wellness, we think of just exercise, right? But that's not the entire piece. There are other pieces to that as well to make sure that we're getting the 360-degree care in order to make our lives better, okay? So I'm going to hit up on the physical wellness piece first because there's the most to it, okay? And then we're going to hit up on the other pieces, okay? All right. So physical wellness, take care of your body for optimal health and functioning, right? Well, how am I going to do that? Well, there are a lot of different pieces to this, right? So one, we got to make positive lifestyle choices about a whole lot of different things. Regular physical activity that are geared to your abilities, and I'm going to introduce a couple of things that folks can do on a regular basis in terms of exercise in order to improve that aspect of the physical wellness. One of our physical therapy specialists will actually be talking a lot more on exercise and MS, I believe either next week or, okay, perfect. So it'll be another lunch and learn. So I'm not going to go into too much detail, but I'll essentially introduce some of those things, okay? Healthy eating, okay? So we're going to talk a little bit about nutrition. Weight control. We know that obesity is an important risk factor for multiple sclerosis, okay? So this is why exercise and eating well is so important, so we can try to minimize how much weight that we are carrying on us. Because not only is obesity an important risk factor for increased disability in folks with MS, but it's also more weight that we have to carry, which is going to mean more potential damage to our joints. It's going to create chronic low back pain, chronic pain in the legs, and it's just going to feed back into that system. So the MS itself feels like it's doing a whole lot worse just because we're carrying extra weight on ourselves, okay? Then there is the importance of primary care, right? So, of course, we are happy to see all of you in clinic and to treat the multiple sclerosis, but we also want to make sure that you folks are also seeing your family doctor, your internal medicine doctor, your family practitioner, to make sure that all the other pieces are being well managed, okay? So make sure that your blood pressures are well controlled. Make sure that the cholesterol is under good control. Make sure that there's no diabetes, or if you do have diabetes, that that's well managed, because all of those things are all stroke and cardiovascular risk factors, which make the MS potentially worse or increase the risk of that disability, okay? So we do rely on the assistance of our family practitioners or internal medicine doctors to make sure that that piece is not being ignored as well, because we want you to be healthy. You're not just MS, you are a person who has MS. So we have to make sure that the other medical issues are also being acknowledged as well, okay? And then preventative health behavior. So we already talked about the smoking, right? But it's also limiting the amount of alcohol use and making sure that you're paying attention to personal safety, that you feel safe in the home, okay? So the exercise piece, right? So physical activity, we all ask you to exercise, right? And we all know that's important, but how much exercise? What should I be doing? What is enough? What isn't enough, right? So I'm going to give you a little bit of information today, and then the physical therapy team will be giving a little bit more information next week. But usually what we recommend in folks who have no disability or mild to moderate disability is that we want you to get in at least 60 minutes of good aerobic exercise per week, okay? But not in one day, right? This can be done over the course of 3 days, 4 days, 5 days over the week, all right? You know the saying, no pain, no gain? You all have heard that before, right? Okay, scratch that with MS, okay? No pain, no gain. I don't want you to have that in your head, because we all want you to recognize your limitations, okay? And we all know that too much exertion, feeling overheated, your body feeling stressed, what happens? Your MS symptoms might start to feel worse, right? You start getting really fatigued, or the muscle cramping starts to pick up, or your burning sensation starts to pick up. So it is okay to conserve your energy. If 5 minutes is all you can do in one sitting, fine. Go ahead and take a break. Make sure that you have a cool down method that's available to you, either a cold glass of water, air conditioning, a little fan, and then go back to it when you feel better. If you feel more tired after your exercise than going into your exercise, that probably means that you did too much. So if you did a 20-minute exercise regimen that day, well, then maybe that means that you need to do 10 to 15 minutes the next day, okay? So it's really listening to your body, okay? There are multiple different ways that folks can exercise. Some people just like going to the gym or using an elliptical or using a bike or using a treadmill at home. That's fine. Some people enjoy using a pool, so it's going to start getting pretty warm out here. So pool exercise is great, aquatic therapy, because not only do you have the pool to keep your core body temperature down, but it also takes gravity away from the situation, so it's a lot easier and friendlier on the joints as well, okay? If you don't like going to the gym, if you don't like using the elliptical or the trainer, then play a sport. If there's a sport that you like playing, then go and do that. That's also a form of really good exercise. If you like racquetball, if you like tennis, any of those kinds of exercise. What we do recommend, though, when you are gauging yourself in how much exercise should I be doing, it's enough to get the heart rate up. So we all say that we want a mild to moderate degree of aerobic exercise, meaning that you can still talk during your exercise, but not enough to sing a song, okay? So that might be a way that you can gauge of how strenuous the exercise is when you're actually doing it. Okay, so I don't want you to go out and kill yourselves over the exercise. I want you to be mindful of what your body is able to handle, okay? And it might take a few different tries to get a good gauge of how much exercise you should be doing in one sitting, okay? Are we good so far? Any questions so far? Yes?
Would walking work as a good exercise, a good walk?
Yep, so what I would recommend is a power walk if you're gonna do some walking. If you're just doing a nice leisure walk and the heart rate is not coming up, then even though it's really good for mobility, that is fantastic, but you wanna make sure that it's to the point where your heart rate is actually coming up a little bit, okay? So maybe like a nice power walk, but that would be really good. But just going out and doing something is a really good start, absolutely. Okay, any other questions so far? Okay, I'm gonna move on ahead. All right, so some folks are quite limited, right? They're either in a wheelchair or they're in a motor scooter, and they can't get up, they can't use a treadmill, or they can't use an elliptical machine because they either have issues with balance or they have issues with weakness in their legs, or if they sit up for too long or stand up for too long, they start getting vertigo or really bad dizziness and lightheadedness. But there are other ways that folks can exercise without having to sit up or stand up, and I know the physical therapist will be going into this in a lot more detail. But there are recumbent bikes, and there are arm cycles where you can actually just use your arms instead of your legs if your legs are too weak to actually use a bike or an elliptical machine. There are ways that you can take away that component so folks can still remain engaged in physical exercise and physical wellness, okay? So nutrition. All right. So this is usually a very common question that we get in the clinic. So what, doctor, should I be eating? How can I gauge what foods are going to be the best for me in terms of my MS? Is there a particular diet that I should be following, right? So we get that question all the time. And there really isn't any evidence-based medicine to support any single diet in particular, except that we want you all to try to focus in on what we call anti-inflammatory diets or a plant-based diet. So the best diet that we really can endorse for you all is what we call a Mediterranean diet. And the reason for that is because a lot of the Mediterranean diet is based on plant-based foods, organic plant-based foods, okay? So making sure that you're getting plenty of fresh fruits, plenty of fresh vegetables in your diet, okay? Dairy is allowed. Just make sure that you're watching how much dairy and how much saturated fats that you're getting in your foods. Whole grains always above white bread, right? Remember white bread, like Wonder Bread, right? So Wonder Bread is filled with particular kinds of sugars that get broken down into particular types of fats that are not good for overall health. So eating breads is fine, right? Some people are like, well, I want to do the paleo diet. Oh my gosh, bless you. That is way too much. We don't have to be doing paleo diet. It's a pain in the butt. Have you ever seen what's involved in a paleo diet, right? You can't eat dairy and you can't eat beans and you have to limit whole grain. You don't have to do that. Whole grain breads are fantastic, just as long as you're not eating the white Wonder Bread. Beans are great, nuts, fruits, vegetables, all of those things. Keeping processed foods to a minimum, like prepackaged foods. High salt diet has actually been implicated as a risk factor for worse prognosis in patients who have MS. We actually have good studies to validate that. So making sure that you are minimizing your salt content, looking at the labels is really important to see how much sodium you're getting on any one particular day. And when you eat out, a lot of the foods that you are eating are loaded with saturated fats or loaded with high sodium. So you may want to minimize how much you are actually eating out in a restaurant and try to cook more at home or have someone in your family cook for you. But it's really the plant-based diet that is really the best thing that you could do in terms of a nutrition standpoint, okay? High fiber, okay? So constipation is a very common side effect of multiple sclerosis, a very common symptom of multiple sclerosis, right? So we're always counseling to make sure that you're getting plenty of water during the day, okay? So at least 64 ounces of water per day. And also to make sure that you're getting at least 25 to 35 grams of good fiber in to help make sure that the constipation piece is not as a significant issue, okay? And then make sure that we are trying to eliminate the concept of malnutrition. So really focusing on all of the well-balanced meals that we can with all of the different foods that we went over to try to decrease the malnutrition and obesity aspect, okay? All right, so how am I doing on time? I have about 25 minutes. So sleep. Okay, so sleep is really, really, really important in terms of overall function and general well health, okay? So we know that sleep helps your brain work properly, okay? So how many of you have had nights of sleep where you're tossing and turning and you wake up the next morning and you feel more tired than actually when you went to bed? Right? I mean, it's not just an MS thing, it's an everybody thing, right? Okay. Well, we know that sleep helps your brain work properly. So when you actually get an adequate amount of sleep per night, anywhere from 6 to 8 hours of sleep per night, and you wake up the next morning, you're actually feeling pretty good because for once you actually had a good night's sleep. You feel more energetic, your brain is able to process information more quickly, and your mood is actually better because your endorphins are going because you're actually able to rest your brain, okay? So we understand that sleep deficiency can lead to trouble making decisions, solving problems, leading to mood issues, irritability, frustration, worsening of depression and feeling sad because we're not giving the brain ample enough time to rest itself during the night, okay? But sleep is also involved in healing and repair of the heart and the blood vessels. So we understand from studies that sleep deficiency can actually increase the risk of stroke and heart disease and can actually make MS symptoms feel worse. Okay, things like obstructive sleep apnea, folks who are not getting enough oxygen to the brain when they're sleeping because they are either they're having issues with their throat closing up and they're snoring and they can't get the oxygen up to the brain sufficiently, or there might be a central problem where they're just not able to get the oxygen up to the brain sufficiently. That can also cause fatigue, that can cause cognition problems, slowing of processing, forgetfulness, attention and concentration issues, headaches in the morning. Does any of this sound familiar to folks? Right? So we always want to make sure that the sleep is also being addressed as well. And then sleep promotes healthy growth and development, and it's really good for the immune system. Okay, fine. So how am I going to help sleep, right? You know, I'm going over why sleep is good. There are multiple ways that we can try to help the sleep aspect, okay? So it's called sleep hygiene or sleep behavioral modification, okay? So sleep only long enough to feel rested and then get out of bed. Okay, so lots of us like to lounge around in bed, especially on the weekends. But once you get up, you feel good, get up and start moving around and get going. Because the longer you lay in bed and do nothing, the more lethargic you're going to feel, and you're just going to want to go back to sleep again, and that's going to interrupt the sleep-wake cycle. Okay, so get up out of bed. Go to bed and get up at the same time every day. So a lot of people like to use the weekend to try to catch up on sleep. Okay, that's not a very good and efficient way to make sure that the sleep aspect of your care is as optimal as it should be, okay? And the reason for that is, again, because of the sleep-wake cycle. So if you try to catch up on sleep over the weekend and then you become deficient during the week, there really is no catch-up period. It actually takes years for your body to catch up on sleep, okay? So during my residency, I mean, gosh, I can't tell you how many on-call nights I've had. I'm years sleep deprived. Okay, so it's really important to make sure that you are getting up and going to bed around the same time every night by about an hour or so, okay? There can be some wiggle room during the weekends, but in order to really improve the sleep efficiency, make sure that you are keeping it consistent throughout the week, okay? Don't try to force yourself to go to sleep. If you can't sleep, get out of bed and try again later. How many of you play the clock game? How many of you know what the clock game is, right? So the clock game is, okay, it's 3:45 in the morning, so if I fall asleep now, I have to get up at 6 o'clock, so then I'll get about 2 hours and 15, right? And then it goes on and on and on. And what is that creating? That's creating stress. That's creating an anxiety, and that is not going to help with sleep. So if after a few minutes you feel that it's just not getting anywhere, get up and try to do something else, okay? Make sure that you have stimulants in the morning. Try not to have them too late in the day. That includes coffees and teas and caffeinated beverages like sodas, anything that's caffeinated, okay? There are certain medications that are stimulants that we use for MS. We have to make sure that it is not interfering with your ability to go to sleep at night, because that is not going to help anything. Okay? If you are sleep deficient, there's no amount of stimulants that is actually going to be able to sufficiently keep you awake during the day. So that piece is very important. Okay? Avoid smoking. How many times have I mentioned this already? Okay. So this is kind of a little break. My dad used to say, you snooze, you lose. I think that's when my insomnia started. So it's called the fear of missing out, right? You know, you're trying to do too much. You're trying to get everything in. You're really stressed about your job or taking care of your family, taking care of yourself. And then that's when the anxiety sets in, and that's when it gets harder and harder to fall asleep, okay? So it's important to be mindful of that, okay? Make sure that your bedroom is dark, cool, and quiet, free of reminders of work. Don't bring work to bed. Don't bring a book to bed. Don't bring the computer to bed. Don't bring the iPad to bed. I tell everybody, the bed is for two things: sleeping and adult playtime. That's it. Nothing else, okay? No televisions in the bedroom, okay? Another important thing is avoid looking at phones or reading devices that give off light before bed, okay? And there's a reason for that. So light stimulation and dark stimulation actually stimulate certain parts of the brain that actually make us want to stay awake or make us want to go to sleep. So if you're stimulating with too much artificial light before bed, the sleep hormones that are trying to get activated are actually going to be suppressed. So your body will actually be tricking itself into thinking that it's the day and not the night, and it's going to be harder to fall asleep at night, okay? So try to avoid anything that's backlit, okay? Solve problems you have before you go to bed. At least try to, right? You can't always do that. Relaxation therapy like yoga and Tai Chi, those can always help with the relaxation bit to make it easier for us to fall asleep at night. And then if these things aren't working, there are sleep psychologists, there are counselors, and there are sleep medicine physicians. And then, of course, there's always other potential medical issues that are interrupting with their sleep, like obstructive sleep apnea. So that's when you want to start talking about these things with your doctor if the other behavior modifications aren't working, okay? All right, preventative care. So make sure you're seeing your family doctor. Make sure you're getting your blood pressure checked. Make sure that you're getting your lipids, your fats, the lipid panels checked. Make sure that if you have diabetes, that it's being well managed. If you don't have diabetes, make sure that you don't develop diabetes. Make sure you're getting the blood work, okay? Wellness exams, right? Women who are of a certain age, make sure that you're getting your mammograms, make sure that you're getting your pap smears, your pelvic exams, make sure that you're getting your colonoscopies. Men, make sure you're getting your prostate checked if you're over the age of 50, okay? Testicular self-exams. Cancer can happen in everybody, even in folks with MS, so we just want to make sure that we are not ignoring that piece either. Okay, and immunizations, okay, flu vaccines, chickenpox vaccines if you need it, and then pneumococcal vaccine, pneumonia vaccines if you're over the age of 65, okay? All right, so that's the physical piece. I want to be able to make sure that I can get into some of the other pieces before we end today, and then I would be happy to take any questions if there's anything left over, okay? So emotional wellness, have a positive attitude, high self-esteem, a strong sense of self, and the ability to recognize and share a wide range of feelings with others in a constructive way, okay? So what can we do for that, right? So develop coping strategies to enhance problem solving, okay? So maybe someone will be brave enough. how do you go about, if you have a problem in your life, what do you go about, how do you go about trying to solve it?
Typically, I start with what the real root of what caused the problem was.
Mm-hmm.
Because a lot of time we get caught up and focused on the problem and trying to just solve it instead of really understanding what caused the problem in the first place. We want to deal with the surface stuff, and there's normally something more than just what we see going on in front of us.
Exactly. So it goes beyond the surface, right? Right, exactly.
And like really assessing what the problem is and where the root started and addressing that so you can really make sure you address all issues with the problem.
Right, exactly. So for those who didn't hear, what was your name again? Shay? Shay, it's nice to meet you. What Shay was saying is that getting to the root of the problem, not just trying to fix the surface part of the problem, but actually trying to figure out, well, why am I having this problem in the first place? Okay. Another way to do this is to, MS, there's a lot on your plate already. Make sure that you are inviting other people into your lives to try to help also maybe with problem solving, okay? Family members, friends, other people out in the community. Try to find someone that you feel comfortable in talking with to try to enhance that ability to problem solve. Manage stress. How many of you get stressed? Everyone should be raising their hand. If you're not feeling stressed, you're probably not alive, right? Everyone gets stressed out, okay? But there are ways that we can help mitigate or manage some of these things, okay? There's meditation, there's Tai Chi, there's yoga, and I know that the National MS Society has a bunch of opportunities in the Las Vegas area to be involved in yoga that is predominantly structured for folks with multiple sclerosis. And if you want, we actually have handouts here at the clinic if you're interested in participating of different centers that are located throughout the greater Las Vegas area to give them a call. Some of the programs are free and some of them it's just like maybe a $5, $10 upfront fee, okay? So all of those things are really helpful. Develop resilience in the face of unpredictable changes. So trying to be a little bit more flexible about how we handle problems and how we handle new stressors in our life. And if things are changed, trying to become a little bit more wobbly, more flexible about some of those things, okay? And foster a positive outlook. And I know that this can be really, really tough. It can be challenging when you have so much on your plate, okay? But really these things can all foster this emotional wellness, okay? Meaning that if you have a more positive outlook on your overall life, then that actually might feed some of those good, happy hormones like endorphins, okay? And sometimes that positive outlook and feeling good is infectious, and you're always gonna wanna feel that way, okay? So try to find something in your everyday life, even if it's 5 or 10 minutes, that gives you joy, that makes you feel happy. Reading a book, painting a picture, watching 10 minutes of really bad TV, anything that really gives you joy. It doesn't matter, no judgment here. I could give you a list of things that make me happy that people judge me on. But really, it's all about you, okay? Make sure that you're doing that, okay? I'm gonna skip over this. Also remain cognizant of mood changes, including depression, anxiety that might require treatment. So there are certain emotional and psychological processes that happen, and it's not just MS, it's in everybody, but there is a significant proportion of people who have MS who have anxiety or have depression or have irritability. And sometimes just doing all of these other things just isn't enough, okay? And it's important to try to recognize that and to bring that up with your physician, okay? Because then we may want to talk about either a medicine or maybe bringing in a counselor or a psychologist or someone who can help try to manage these things if it's too much for you to handle, okay? All about mindfulness, okay? Occupational wellness. So a lot of people think that occupational wellness is not just a sense of, it's just a sense of wellness of while you are working, okay? So not everybody works, right? Some people are either on disability or they're retired or they're working at home or they're a homemaker. You know, we all have different backgrounds, right? But it's really the opportunities that exist at work, home, and in the community, okay? And it's all about what you are able to contribute, not just to a workplace, not just to a formal workplace, but what you as a person are able to contribute in your home, out in the community, okay? So we all have an important piece here. And all of those things, feeling like you are self-accomplished, feeling that you are contributing something, is what's going to happen. You're going to start to feel good about yourself. It's going to promote self-confidence, and that is also going to be an excellent piece for the emotional wellness portion as well, okay? And then also know your rights, okay? So make sure that if you have not already established with your employer, if you're still working, about reasonable accommodations, that you have a discussion with them. If you feel that you are working in a position that is challenging for you, and you need to have a conversation with them about what you consider is a reasonable amount of work for you based on what disabilities you have, there are protective services in place for you, so you can freely have that discussion, okay? And we have social workers here, and then you can always have a conversation with your physician in terms of trying to figure out, is this something that you need to be concerned about, aware about, and how do I go about doing that, okay? Spiritual wellness. Find meaning in life events, demonstrate individual purpose, and live a life that reflects your values and beliefs. So spiritual wellness is not religious wellness, okay? If you have a religion, that is fantastic, but it goes beyond that, okay? It's developing a worldview that promotes a sense of peace and harmony, okay? It enables yourself to cope and adapt through life, and the ultimate goal is to find meaning and purpose in your life in the face of challenges, okay? So even if that means that you just meditate a couple of times per week, or you're able to get a sense of that peace and harmony when you're doing yoga, or if you're just sitting on your couch and you have an opportunity to reflect, those are all pieces of the spiritual wellness piece, okay? And social wellness, building relationships with others, dealing with conflict, and connect to a positive social network. So again, really that is endorsing what I was talking about earlier in making sure that you are feeling like you are important, that you have something to contribute, okay? That can be at work, that can be at home, that can be at MS groups, through the National MS Society or the MS Association of America. That can be with a group of friends. It can be with a group of strangers. Any way that you feel that you're able to connect with people, form relationships, and make sure that you're finding that the relationships you do have are positive relationships, that there's a sense of give and take, that you are contributing, but that person is also contributing to the table as well. Okay, making sure that you have a sense of connectedness with the community. That is really important, because the last thing you want to do is feel isolated. Okay, another way to feel connected is to participate in events such as this, where you have other folks such as yourself who have multiple sclerosis, because they understand what you're going through, okay? Some of us, we don't understand because we've never felt that before, but that increases the sense of community and how you are able to connect with that community, okay? Intellectual wellness, be open to new ideas, be creative, think critically, and seek out new challenges, all right? So what does that promote? That promotes personal growth, it promotes enhanced creativity, and it promotes new learning. So just by coming to this event right here and listening to me talk for about an hour, this is opportunities for increasing your intellectual wellness. And there are other ways that you can do all that in the community as well. You can learn from somebody, but you can also teach somebody. And it doesn't have to be in a big group like this. It can be one-on-one with somebody else, okay? And that is really all of the different pieces all together, and there's a reason why they're all connected, right? All of those pieces connect somehow, some way, shape, or form to all together put together this concept of wellness to improve quality of life for you all to lead better lives in living with MS. Okay? All right. Well, that's all I have for you, but I would be more than happy to take any questions that you have. Yes?
Can I ask you something about new drugs that are coming out for MS?
Sure.
They-
Sure. So let me make sure that there aren't any other questions regarding this. And would everyone be interested in learning about this question? If not, we can just talk one-on-one. That would be fine. There was a question about new medications that are coming out for MS. Okay. Any other questions regarding the wellness? And then I would be happy to take your question. Okay. All right. So what was your question?
I'd like to know what you think about the new drugs, or if there are any new drugs coming out that don't have horrible side effects for MS.
Sure. So there is a new medication. I don't know if you had one in mind. It's called ocrelizumab. That's a new medication that is coming out probably not until 2017 at this point. That is actually looking to be a pretty good medication for both relapsing remitting forms of MS and even progressive forms of MS. Right now we don't have any medicines to help treat progressive MS. So this would be the first medication, if it's FDA approved for it, to treat that aspect of MS. It is a medication that's an infusion. So you would have to come in and get that infused every few months or so. But it's actually looking really promising with a good side effect profile.
That's what I was going to ask you. What about the side effects?
The side effects are looking to be pretty similar to the interferons like Avonex, Rebif, Beta-Seron, just some flu-like side effects and maybe some infusion reactions and those kinds of things. But overall, the safety profile is looking pretty doggone good from the get-go.
How often do you have to take it?
It would be every 6 months or so. Mhm. Yeah.
Thank you.
Yeah, no, absolutely. Any other questions?
Well, you brought up viruses doing things, and recently there was an article in the paper about a virus that's in South America that is affecting people. How would you equate if you had a virus,
Sure.
whether or not that completely left your system
Yeah.
and is doing something within there?
Yeah, so that's actually a tough question because a lot of the time we never know what triggers the onset of MS symptoms. Sometimes it feels like it's completely spontaneous. And even if you've had a virus in the past, does that necessarily mean that it's what, triggered this whole thing to begin with? And that's why we're doing more and more studies. So we don't know for sure of any one particular virus that causes MS. All we know is that there are certain viruses out there, Epstein-Barr virus, there's a chlamydia virus, that have been implicated as potential triggers for someone who already had the genetic predisposition, already had some biological change in their chromosomes that would predict them developing MS at some point in their life. So if you don't have that genetic predisposition, then a single virus probably won't cause MS. There has to be some sort of genetic predisposition beforehand. Okay, so the virus in South America, I'm not sure if I'm aware of that virus.
Are you talking about Zika?
Are you talking about the Zika virus? So I haven't actually read about that having any implications with MS. It's only been about the pregnancy issue with, teratogenic effects and issues with fetuses and things like that. I haven't read anything about MS itself. But I can try to find it, and then I can try to get back to you on that one. Any other questions?